Hello and welcome to the Carers Dundee Virtual Hub, episode 4. My name's Claire and I work at Dundee Carer Centre as a Community and Media Relations Officer. And today we are speaking with Gill Stranock, who is the team leader at the Caird Hall Vaccination Centre. Hi Gill, welcome.
Hi, Claire. My name's Gill Stranock, just for everyone's benefit. My name's Gill Stranock, and I'm the team leader, one of the team leaders at the Caird Hall Vaccination Centre in Dundee. Nice to
That's
see you.
Yeah, well, thank you very much, Jill, for coming along. I know how hectic and busy it all is for you guys just now down at the Caird Hall. So I really appreciate you taking the time out to do a quick virtual hub with us, just to ease any anxieties or concerns some people may have in regards to coming for their COVID vaccinations.
Yeah, that's
Okay,
fine.
thank you. So, Jill, we do have some questions for you, if that's okay. Now, the first I suppose all the questions kind of cover the same basis, but they just come in a different way. So I appreciate some of the questions might kind of double up with the answers. But initially, for some of our carers and their families, this might be their first time visiting the town centre or the first time coming out of their homes due to shielding or isolating as a family. Now, how could carers feel safe and less anxious when coming down to their appointments?
Well, we've made visiting at the Caird Hall well, as welcoming as we possibly can. There are friendly, approachable staff at the door who are very alert to anyone feeling anxious. All of the staff, of course, adhere to the guidelines, the Scottish guidelines, the government guidelines, keeping your 2 metre distances, all of those kind of things. So we really do try our best to make it as easy and as accessible as possibly can.
Okay. Now, I've actually been for my first jab because, as well as working at the centre, I'm a carer for my dad. So I could kind of second that, where I did feel very welcoming and very safe and at ease when I came down for my vaccination. I think the anxiety is there straight away, I think, but all the staff from the front door right through were very welcoming.
Good.
But I think although it was easy for me, obviously making that initial step and coming down to the Caird Hall, there was no queues for me. It was quite easy, and I was able to get in no bother. But some people might feel quite anxious in crowds.
Yeah.
So, especially if they've got anxiety, is there what's in place to help people who might feel like that?
Well, we have security on the gates and entering the Caird Hall, and it's rare that we have a large queue. I
Okay.
mean, it is very rare. Um, our appointments are actually made up really carefully, and they're actually made up of 10 minutes in between each appointment.
Okay.
So not very often you're going to get a queue. However, if it does happen and anyone came down and they felt nervous or anxious, then it's quite easy for them to go and approach any staff member, and they can always take them round into the Marietta Hall end, where it's nice and quiet, and we've got a nice quiet area for them to go to.
All right. Okay. Oh, perfect. So you do have an extra space, so the people are out with the crowded areas as such.
Yeah, we do. There is, you do go up to the gates initially. Well, the barrier that's there, and there's security staff there. Now there is, when you go into any airport, you have the queuing system where you go up and down, and we do
Yeah.
tend to have that there as well. But it's very, very rare that there would be lots of people in that queue.
Okay.
Really quite slick actually inside the Caird Hall. The way the vaccinations run, and obviously the appointments run as well. So we tend to get people in quickly, and hopefully they're not waiting, for long periods of time. It would be very unusual.
Oh, that's good to hear. So if somebody was feeling a bit anxious, approach any member of staff and just make them aware of the situation, and they would easily be signposted to the. So when you're speaking the Marriott Hall, and is that like up the ramp end to on the right hand side?
That's right, yeah. So
Yeah.
looking at the Caird Hall to the right hand side, we also have an entrance into the Marietta Hall end. You don't
Okay.
actually go to the Marietta Hall, you go, well, there's a ramp, and there's obviously stairs as well. So
Yeah.
you would go in that end and kind of into the back. Either if you're going into the Caird Hall itself, which is a big, big area,
Yeah.
some people are nervous and anxious, obviously wouldn't want to go into such a large area.
Yeah.
So we have another wee quiet area just round the side. It's quite a large area as it is that in itself, but it's all sectioned off, and there's only that one person in there, with the nurse as well. So it's a really nice area actually
Oh,
to
that's
have.
good to hear. Very good. To be fair, I've actually, when I was down there, I did have a chat with some staff, and I did see the area, and it is. I mean, it is in the bar area, isn't it? It's the bar area where it used to be the bar area at the Caird Hall. It's within there, so it is very safe and very private as well, obviously for people. Yeah, good.
Yeah.
That's good, great. I think that'll make a lot of people feel at ease to know that that is there. So I'm hoping that people, if they do feel the need that, they could easily just talk to staff if they feel that, or speak with somebody they work with or somebody that's supporting them, and they can obviously try and find out how easy that is to be set up if need be. Yeah. Okay. Now, when I was in the centre, obviously, I had to wear my mask. But if somebody, obviously, a lot of people are exempt from wearing masks. Does that still stand?
They can still attend, even if they don't, if they're really uncomfortable wearing a mask. I mean, we
Yeah.
absolutely appreciate that. There are lots and lots of mental health issues, lots of reasons why people can't wear masks. We do
Yeah.
understand that. Again, we use the private area because obviously we have to look out for other people coming
Yeah.
into the Caird Hall too. So we do tend to use the private area, and we'll take them into there and attend to them in there.
That's good. That's great. And I suppose that is another thing for people, I think, is, and I can't wear my mask, but there'll be other people there that are wearing masks, and there'll be how they feel that. I mean, that's another anxiety for some people. So to know that obviously that is not a barrier, and hopefully that encourages people as well to still come along and get that. Now, I suppose as well as that, I mean, a lot of people who are in caring roles might need to come along with the person they're currently supporting, or the cared for person. Is that okay to do that? Is it okay for them to bring along somebody if there's nothing else for them to avoid that? Yeah.
Absolutely. I mean, we understand it's not always possible to have someone look after the person that you care for. And, at times you would have to bring them with you, and that's absolutely fine. Again, we've got the lovely private area that we could take
Yeah.
people to. Or, I mean, if they felt okay, they could go into the Caird Hall itself. It's entirely up to them. But yeah, absolutely. We really want
That's
to get people in to get the COVID vaccinations. The quicker we can get this done, the better for all, hopefully.
Yeah, definitely. Well, like I said before, I mean, I think it was a great setup. It did make me. Don't get me wrong. I did feel, but I got there early because I thought I want to avoid any queues. But I got there early, no queues, and I approached the staff at the barrier. They said, "No, on you go, on you go. It's fine." I went through. I spoke to maybe a couple of staff members in the main foyer. Then I was kind of guided through to the main Caird Hall bit. But every staff member I spoke to, the volunteers that were involved, and the staff and the nurses as well, they were all made me feel very at ease. I'm not one for needles, but it did make me feel very ease, and they were lovely, lovely people. And I was in and out within 10, 15 minutes. I mean, it was a very good, setup for me. And all the one-way system as well that people do follow. I mean, you're not bumping into anybody else, and it's good flow. It's a very good flow.
Yeah, that's actually really nice feedback to hear. I
Good.
mean, the staff at the Caird Hall and obviously all the nurses. I mean, we work as an enormous team, and
Yeah.
everyone works so well together. I mean, we all do try really, really hard, to make sure. It can be difficult for anyone coming out of the house for the first time in a long time. Some people have
Yeah.
been in for a long time, so we really do try our best to make sure
That's good.
it's as nice as possible for everyone.
Good. And I suppose I want to send back that as well was that even the registration of it all for myself. I mean, I'd done the registration online, which was all obviously provided through the government links and things. And even that, initially doing that, I got my appointment within like a week of doing the registration as well. So I think from start to finish, it was such an easy setup and an easy outcome for me. So I would encourage anybody, obviously, in an uncaring role to register and get get the vaccination, definitely.
Oh,
But it's good to know that staff are there to help with any anxieties, to support as much as they can, and just to make that a bit simpler.
yeah, absolutely.
Okay, Jill. Well, I think we've covered the most everything that we need to know. I suppose people might have more questions after they see this live recording. So if that is the case, please, people, feel free to put any questions in the comment section below. You can email us, or we can, and anything will be set up on our Carers of Dundee website page to make this a bit easier for you too. Okay, Jill, well, thank you very much for joining me today. It was really appreciated taking time out to speak to us.
That's no problem at all. Thank you very much for having me.
And all the very best for your time at the Caird Hall Vaccination Hub. And I hope it all goes well.
Thank you. See you
Okay,
soon.
Jill, thanks very much. Bye.
Bye.
Well, thank you for listening to our live recording today. I think it's been a lot of very useful information received from Jill. But as I said, if you do have any questions, please put them in, get back to us, direct message us, pop it in the comment section below, or email the centre at centre@dundeecarercentre.org.uk, and somebody will get back to you. That's the end of our live virtual hub for today. As always, you'll find the links for this hub and previous hubs on the Carers of Dundee website, www.carersofdundee.org. And we'll be back with you for our May hub. So please keep an eye on our social media pages, and we'll keep you posted with the future hubs. Thank you for joining me. Take care. Bye.